Welcome, Dana.
Thank you. Thank you so much. Hi, everybody. Thank you so much for being here today. And thanks, Ashley and Yana and everyone for having me as a guest presenter. I'm really excited. I always love talking about this topic. It's something I've been presenting on for nearly a decade of my life, and I still love talking about it so much. Starting solids. So, this webinar is best for parents of infants age 4 to 6 months old. So if you have not started solids yet, or if you're just in like the very beginning days of the process, this is for you. So, a little bit about me. I am a mom of two kids. They are 10 and 8 years old, which I can't believe. And I've been teaching about starting solids for like 8 to 9 years now. My course has evolved over the years based on my personal and professional experiences, as well as the research. But one thing has always remained constant, and that's my desire to help remove parent stress around feeding their babies. So I've now added some ongoing support and peer support for my Starting Solids course, which goes way more in depth on this topic than we have time for today. And I'll tell you a little bit about what's in that towards the end and like things that you want to be thinking about after you have the knowledge of what we talked about today. And then just as a side, I do also see patients on a one-to-one basis with virtual visits. So parents can join just like right from home. You don't have to go anywhere, package up the kids to go. That's what I do. And as you can see on the screen, my mission is not just to improve people's physical health, but also, and most importantly, their mental health. Having positive interactions and connecting over food with family members is linked in studies to reduce risky behaviors, eating disorders, and even suicidal ideation among older kids and teens. So, reducing all of that for the families that I connect with is really the driver behind what I do. And of course, along with all of those outcomes comes more success in life, more academic success in school, better relationships. So, I love all of that. And the reason why I love focusing on starting solids is because this is the best time to start instilling these habits and values for all family members. So when I decided to pour my work into an online format, I actually was creating a course for like picky eaters and older kids, like families with like problems at the table. And I kind of put a pause on that. I'm gonna come back to it later, but I decided like why I already have this starting solids class. There's so much that you can learn in the starting solid stage that can prevent all kinds of problems moving forward. So I decided to kind of like back up the timeline a little bit and make it more about prevention and teaching parents how to do things from the start so that you don't run into those problems later, like problematic picky eating, battles at the table, and so on. So that's why I do what I do. That's why I love this focus on starting solids. I want you to remember through the next few months that your efforts now are going to pay off throughout your child's lifetime. Then everything you do now or don't do now will have an impact. And of course, I don't want that to add a lot of stress. We're going to talk about how to like not let that worry you, but really to be prepared today. So before we dive into starting solids, I want to get a good feel for how you're feeling about this next stage. It can be exciting, it can be scary, it can be overwhelming, it can be confusing, and like all the different emotions all at one time, a lot of times. So if you don't mind typing in the chat box, just some emotions that starting solids brings up for you and how you're feeling about this stage right now. And if you want to also just kind of like share, if you've started solids yet, or if you're still like thinking about it really early on, to provide some context, that might help too. And I'll give a moment for y'all to type some of those feelings in the chat box. Excited to start. I love it. That is awesome. Well, that excitement is it makes it fun, right? And I know not everyone might be like excited, but then also there might be some other like, confused feelings. Okay, see, yeah, Mama recently told me she was anxious but excited. Exactly. You can feel like all the things at once. 5.5 months old, overwhelmed by all the options and ways. Okay, this is the perfect webinar for you that just wrote that with the 5.5 month old son. We are going to go over all the options today and how to figure out which method is right for you and your family. I see you nervous, looking forward to it. Awesome. So thank you so much for sharing all of that. It is like kind of like a personal topic for sure. And I realized very early on in this wild game of parenting that there is far too much judgment placed on us, everything we do for parenting. And the result of that is a sense of pressure and overwhelm with like every single decision that we make. And it was nearly a decade ago, like before I was the experienced pediatric dietitian that I am today, I even used to think that there was just like one right way to start solids. I actually used to teach a class just on baby led weaning, where I taught parents that that was the ideal way to start solids. And I'll explain what baby led weaning is in a little bit for those of you who haven't heard of it. Um, but after years of working with new parents and becoming much more well versed and trained and learning much more of the research on all aspects of infant feeding, and of course, listening to my gut, knowing it just didn't feel right for me that there would be one right way. So I changed my tune after all of that. There are lots of different right ways to introduce solids, and there are some key aspects that every parent needs to know and practice, which can be done using any number of methods. So that's kind of what like was the birth of my Starting Solids Your Way framework, because I want every family to feel comfortable and confident with what they're with how they're doing this really important step. So today, even if you came here feeling nervous or a little afraid, anxious, I want you to walk away feeling a little more excited than before and more confident, a little bit less nervous or less confused than you were before. So that's my goal for you. So, how many of you have heard this phrase? Food before one is just for fun. You can do the hand raising or just yes in the chat box if you've heard that, or just think through like if you've heard that before. Yep, I see at least one person. So I actually used to repeat that phrase often as well. And I know that it was started with really good intentions and philosophies that I 100% agree with. It's rooted in the idea that we don't need to worry or stress over how much food our babies eat. And absolutely, that is the case. We do not need to worry about that. But it really does a major disservice to babies. And after years of working in depth in this area, it really doesn't sit right with me. Food before one is for so much more than just for fun. And if we parents don't learn the important aspects of feeding our babies, we're going to miss some really critical opportunities for health and development, and some of which are irreversible. So let's look at what all of those are. So based on the research that's out there, I categorize these into 4 pillars of what food before one is for. Yes, it's for fun, and that's included in one of these, but it's also for these 4 things. So nutrient density, the nutrients that we're providing starting at 6 months can help prevent brain malformations and growth problems. So there are some nutrients, iron is one example, that like breast milk doesn't provide that. Formula does, and so that formula that's made in the United States does have iron, is iron fortified, and will have that. That's just one example of a nutrient that doesn't quite come in the amount that babies need, especially with breast milk. And so solids is what's going to help fill in the gap for that, for the iron that's needed. But there are other nutrients too that are really important. And if babies aren't getting enough of those, then they are at risk for all types of deficiencies. Then we have allergy introduction. So, and I feel like this is the topic I get asked the most about, or parents want to know the most about right away. They feel like it's like the main thing. And this actually is like the kind of core piece of my like baby meal planning that I go through in my course. Based like we do allergens first, and then we kind of expand from there. But there's so much more to it. But allergens need to be introduced early and often, meaning like right at around 6 months, we want to start introducing allergens and then proceed from there. We won't have time to go through it today. I get asked about that a lot. We won't have time to go through the exact process, but I want you to know that the earlier you introduce allergens, the less likely your baby is to develop a food allergy. So it's actually considered an allergy prevention method is early introduction. Boosting baby's confidence. This is part of where the fun comes in, right? This is the time where you can help babies see meals as fun. It's building a healthy relationship with food, but also with you, and learning how to interact with food and learning how to do that on their own, like becoming their own little eater is really important. And so, doing things a particular way in these early months is really important for that. And then we have exploration and learning, and the fun falls into this category as well. But with along with the fun comes, building coordination. They build strength. They build like that hand-eye coordination specifically, and all the motor skills that they're going to need for all their areas of life. They get to practice at the table, and get to get really good at it at the table as well. So, it is kind of exciting to realize that the actions that you take right now are going to impact your baby's brain development and eating behaviors for the rest of their life. And what you do right now is going to be key in cultivating a positive relationship with food for your baby. So, again, not to add extra pressure, but it is to say, great job for attending this talk today and paying attention to what your baby needs and what you can do to positively impact their physical and mental health. And then hopefully this also inspires you and motivates you to then follow up with like learning more in depth about each of these areas so that you can do everything the best way possible to give your baby the best future possible with not just food itself, but also, all of the confidence and everything that comes with being a confident eater. We see in studies that bleeds into other areas of life. So it can really help them overall in every area of their life. So, of course, we're not here, we don't have time to talk in depth about all of these, the different factors within each of these today, but we're just here to talk about those very early steps of starting solids. So we're going to go through the signs of readiness and then learning about the different approaches. And then I'll help you decide which approach might be best for your family, or at least give you the information so you can take that back to your parenting partner or anyone else that's helping you and use this information to decide with them. So these are the signs of readiness for starting solids. It's really important to know that you need all of these signs of readiness need to be like accomplished, check the boxes before your baby starts solids. There are a couple of like caveats here. One thing to know is like, especially regarding the age and some of the developmental stuff, if your baby was born premature, that requires a more individualized approach. And of course, like if you wanted to work with me on that, you could, or just talking to your pediatrician, or if your child's in early intervention, you can work with your occupationalist or occupational therapist or speech therapist to get some support on like timing and what you're looking for. But for normally developing term babies, these are the things that you want to have in place before your baby starts solids. Number one, and the one that is like there's the most misinformation about this one, is that you want your baby to be around 6 months old. The recommendation in the United States up until about 5 or so years ago used to be to introduce solids around 4 to 6 months old. There was like a range. The World Health Organization has had it at 6 months old for a very long time, much longer. I'm not sure exactly when they changed it. I should probably look that up so I can say it in my presentations. But much longer, the World Health Organization has said wait until around 6 months to start solids. The United States was a little lagging behind, but around 5 years ago, in the United States, the American Academy of Pediatrics put out a statement and a standard that parents are supposed to wait until baby is around 6 months old to start solids. So the problem is that a lot of pediatricians have not switched what they're saying in appointments. So most of you, I'm going to assume most of you, have probably heard your doctor say at the 4-month visit, oh, you can go ahead and start solids now. And that's what they're putting out there. Just because they say you can doesn't mean you should. And also, I want you to know that that is an old, outdated recommendation. The reason for waiting until 6 months old is there are a lot of reasons. The most important one, and if your baby's meeting all the rest of these signs of readiness, but they're 5 months old, the reason why I would say to still wait until closer to 6 months old is because their digestive tract is not quite ready yet for food. So I do see a lot of patients in my one-to-one practice that come in where babies like, dealing with like constipation and other digestive issues, and they've started solids already at like 4.5, 5 months old. For those, if that applies to any of you, I usually will tell them like, let's stop the solids for now. Just go back to infant milk only, and we'll wait until baby's older. And that usually solves the problem. Not always, but usually. So, so that's like one of the reasons for that. The other thing is like they're, even though they might be like sitting up straight and like everything's good, they just might not be like mentally, developmentally ready for it. I was actually just talking with an occupational therapist about this recently, and she was saying like even if it looks like they're meeting all the other signs of readiness from the outside, sometimes they can be having a bad experience and then turn them off from sitting at the table or engaging with food just because they're having a bad experience and that you can't tell, like you don't know why. So waiting until 6 months old ensures that they're really ready for it. And then also, our bodies were made in wondrous ways. Like we are, all the reflexes that develop around 6 months old are there to help babies eat. So it makes sense biologically to wait until that time. And I could go on and on. I won't, but I could go on and on about why, like, we're starting solids earlier for a period of time in our industrialized history. But if you look back to like before industrialization, when we were like cave people, babies' reflexes weren't really there to start eating. There wasn't like pureed food or anything like that at that time. So like they were starting solids around 6 months old. That's just kind of like how we were designed. So okay, so number two, solid head control. That usually happens much before 6 months old. But if it hasn't happened yet and your baby is around 6 months old, that's definitely something you want to talk to your doctor about to see if your baby needs to get assessed by a physical therapist or what your doctor recommends there. They need to have solid head control for safety. Number three, sitting upright with minimal support with a straight spine. What that means is that they're sitting up like this with good posture, if you can see, like sitting up straight, right? If they're really slumpy, like if you put them in, strap them in the high chair and they're like all slumped off to the side, they're not quite ready yet. That's tall, straight spine. That happens like kind of quickly. Like if your baby's at 5.5 months old and they're nowhere near that yet, don't panic. They'll probably likely get there around 6 months old. You don't need to set a timer. I've seen that in like baby led weaning groups. Like you have to time them. They have to sit up for 20 seconds without falling over. That's like they don't get that for a while. So you can ignore any of that. But you just want them sitting up with a straight spine and to be able to catch themselves. Like if they're sitting up and they kind of fall to the side, they can put their hands down and they're stable enough to catch themselves. That's great. Grabbing things and bringing them to their mouth with precision. Again, that usually happens like 5 months old. They're usually already doing that by the time they turn 6 months old. And then this last one, interested in what you're doing or interested like watching you closely while you eat. If I had a dime for every time a parent has told me that they saw that, and then that was the reason they started solids at like 4.5, 5 months old, I would be not working right now. So that alone is not the only sign of readiness. Like that's not the only thing that you need to check off to like go ahead and start solids. Your baby's going to be interested in what you're doing. You are the most important person in their life. So once they're able to like capture you with their vision and like see what's going on, they're going to be watching what you're doing. They're going to be very interested in what you're eating. They might even follow the food with their eyes. That's great. That's one of the 5 signs of readiness, but it's not the only one. So you need to still wait until they've met all the others before you actually dive in and start. The one thing I also like to point out that you don't see listed here and that I get asked about a lot as well is tooth eruption. That is not listed, and because it's not important. So your baby's teeth are in there. They're just covered by a little layer of gums, right? So they're able to manage whatever textures and foods that they're developmentally like appropriate for, just with no teeth that you can see, but the teeth are there. So they still can chew and do what they need to do with the food. And keep in mind, the first teeth that erupt are like usually the two like bottom front teeth. Like there's no chewing that happens with those anyway. So don't worry about whether they have teeth, how many teeth they have. That's like not at all relevant to this stage. Okay. So here are the different approaches that parents use that are possible to use for starting solids. We have a purees approach right here. This is what you see all the time on TV, what you're probably very familiar with, where food is blended up into a liquefied, consistent, liquefied consistency, uniform consistency, excuse me, that babies that like spoon fed, right? The parents put it on a spoon, feed it to baby. So that's purees. Then on the kind of like opposite end, we have baby-led weaning. So baby-led weaning has nothing to do with weaning away from breast milk or infant milk or anything like that. It's weaning. The term was coined in the UK, and that's they use weaning to talk about like the first steps of incorporating other foods. So baby-led weaning is where, just like what you see here, a baby is given finger foods that they can pick up with their hands and bring to their mouth and eat themselves. So it's totally like self-feeding and like chewable foods sort of from the start. Usually start with mashed foods first and then quick progression to foods that they can chew. And then there's a combination approach. Combination is just what it sounds like. It's a combined, it's like both, right? Maybe in one setting, a baby is doing purees like at daycare. If the daycare providers aren't comfortable with baby-led weaning, but the parents want to do it, then that would be a combination. At home, baby does baby-led weaning. At the child care center, they do a combination approach, or I'm sorry, a purees, and that would be a combination. Some parents like to do baby-led weaning, but then also offer purees, like either spoon-fed or like as dippers. Totally fine too. So there are lots of different ways to combine the two. And I want all of you to know that all three of these are equally great options. So you don't need to feel like just because your neighbor is doing baby-led weaning that that's the thing that you have to do, or because your cousin told you that purees was the best because they felt like it was safer or something like that's what you have to like. Everybody's different. So let's talk about who might want to go use which method. So for purees, if any of the following are true, then starting with purees could be a good choice for you. I'll go through these. I know it's a lot of words. I want to make sure that you know, though, the first two that have the little asterisks here, if those are true for your family, then purees is like, that's probably the only option, the only good option for y'all. Okay. So those are if your baby is 6 months old and the doctor has approved starting solids, but they're not yet meeting the milestone of like sitting up straight with minimal support, but the doctor's okay with them starting, then purees is going to be the best option for you. If your baby is 6 months old and they have any developmental delays that impact their ability to eat food, to chew food, again, this is probably going to be the best for you. The rest of these, though, like it's totally up to you. So if those are not true for you, but maybe you have an overwhelming fear of your baby choking on finger foods that gets in your way of your ability to feed your baby and to be calm at mealtime, absolutely start with purees. If you have purees, available in your pantry, maybe you use WIC and you get purees from them, or maybe you had a bunch of hand-me-down purees and you want to go through those and use those. Great, that could be a good option too, as long as you're following the kind of nutrition recommendations. And then, or if it's, within your budget, you're to either time budget to make purees or financial budget to buy purees, then like, by all means, that would be a good option. And for any reason whatsoever, you feel like purees is your way to start, then start with purees. Next, we have baby-led weaning. So this one, again, we have a couple of like caveats here. So these top two must be true if you want to start with baby-led weaning. Okay, so baby needs to be meeting all the signs of readiness, and they have no suspected developmental delays that would impact their ability to chew. As long as they meet those two, then you could start with baby-led weaning. Doesn't mean you have to. If you're excited for your baby to dive right into self-feeding and experience a variety of textures, great. If you're feeling confident that they're ready to chew food, they're ready to do it. If all the caregivers who feed your baby are comfortable with this method, then this could be a good one. And some parents choose this simply because they don't have the funds to buy pureed foods and they don't have the time to make it. And it's just easier to like feed baby what they're eating. Then this would be, right for that type of family. And then again, if for any reason whatsoever, as long as your baby meets these top two, then if for any reason whatsoever you feel like baby led weaning is your way to start, then that's going to be the best one for you. Now we have the combination approach. And because it uses baby led weaning, you do still need to meet those top two with the that I just went over, like with the asterisks here. You still need to meet those in order to be able to do a combination approach. But a combination approach might be best if like if you are excited for them to dive into all the textures, maybe you have a lot of purees in your pantry and you want to use them, but you also want them to be exposed to different textures in that self-feeding right away. That's great. Also, as I kind of alluded to before, if you have your heart set on baby led weaning, but like somebody else who will be feeding your baby is not comfortable with it, then you can do it two different ways. Contrary to what you may read online or hear from other like non-professionals or non-untrained professionals, it's not confusing to baby to do some puree and then sometimes baby led weaning. Purees are another texture, right? So like I just had some applesauce the other day. Like that's a pureed texture. I'm an adult. I eat it. It's not confusing. So it's one other texture. So you don't need to worry about like baby getting confused over which thing where. That's not to be a concern. And then I think I went through the rest of those. Yeah. So so yeah. So all three different methods. Hopefully you have a little bit more clarity on which one is going to be right for you. I do want to point out that even if you start with purees, I do recommend a relatively like quicker than you're used to progression into chewing food. And that's where, when there's a window of time, window of opportunities of learning to chew. And around 8 months old, 8 to 9 months old, that window starts closing. So you do want your baby to be chewing food before then to give them that experience and to help with their motor skill development. So even with starting with purees, there is like I guide my participants in my program and my patients on like how to go about progressing safely and at a rate that's comfortable for you. So no matter which approach you choose, though, these are important for all of infant feeding. So I mentioned allergen introduction before, iron foods, variety of foods, offering a variety of flavors and textures, progression, like I just mentioned, prioritizing infant milk. So when your baby starts solids, that doesn't mean they're suddenly going to not drink as much milk. That doesn't happen until much later, like 10, 11 months old. And it's baby led, like the baby will start drinking less. You don't need to do anything for that. Family meals are really important, going along with role modeling, like you chewing and eating food in front of your baby and with them, eating family meals together. And again, this is like something I coach my families on that I work with, because if you're not already eating with your partner or any other family members, this is a great time to start that habit. But it can feel pretty overwhelming when you've got like a baby on your hands. So starting slow is perfectly okay with like coming together for family meals and eating together. And then really important to tolerate the mess. Let your baby make a mess. That's part of exploration. And it helps them be more comfortable with exploring new foods, trying new foods, and everything that goes along with growing into an older infant and then a toddler. Because everything you do now is going to set them up for success and set you up for success through toddlerhood, which we all kind of, I think, associate toddlers with being really finicky eaters. And it doesn't have to be that way. You can set yourself up for success with that now and through this next, the first 6 months of eating, like through up until a baby turns one. There is a lot you can do to prevent problematic picky eating later on. So let's see, we have about like 10 15 more minutes. So I'm going to go through this like kind of quickly, so there will be time for questions. I did want to say this is something I'll have Ashley or somebody from Yana and Mom send out afterwards. This is just like a little checklist to go through before you start solids. This is how you can prepare. So this is especially great for those of you who like haven't started solids. I think I saw someone here with like a 3 month old, 3.5 month old. So this would be great to use in that stage where you're just like not quite there yet, but you want to make sure you're all prepared. So, making sure your baby is met or is on track to meet all their signs of readiness, asking the pediatrician at their, at the 4 month visit, but then again at the 6 month visit, if they have any developmental concerns for your baby related to feeding. Decide which approach you're going to take, which hopefully you have a little bit more clarity on that now. And I will say, if your baby is not quite 6 months old and you've decided, especially with like the baby led weaning that has like those required things that they meet, just be flexible, be open to like if they don't develop as expected between in the next couple of months, it's know that it's perfectly okay and nutritious and developmentally appropriate to start with purees until they get to where they're ready to consume chewable solid foods, and that's okay. But if you've decided where you want to start with, then you can make changes later on, but at least you have a direction that you want to be going. Getting a high chair or a booster seat that allows your baby to sit strapped into the chair for safety and with an adjustable footrest so that their feet can touch the footrest from the start, and then it can lower down as they get older. That support is really important. It helps them learn to swallow, and it helps with just like their posture and everything too. So, and unfortunately, it's not a required part of a high chair. That's like not within the standards of like what they when they make high chairs. So unfortunately, it's something that you have to shop for. And if you already have a high chair or a booster seat and there is not a footrest, that's okay. You can make one. Or maybe it has a footrest, but it's too low and it's not adjustable. You can like duct tape some yoga blocks or just another box, something that's really sturdy to the footrest to raise it up. Some people use like a rolled up towel that they tape on there. So you can get really creative, and I like to help people get creative with that as well. Um, and then already, I mentioned this before, just start getting in the habit of eating together. Starting now is going to be get you on track so that it can be more regular and feel more natural all the way up until, or by the time your baby is like growing into an older infant, and it can be like more of the thing you do regularly. And then this last one does not get talked about enough. Checking in on I did not coin the phrase food legacy. I don't remember who taught me that, but I love it so much. So I borrowed it and I wish I could give them credit. But checking in on your food legacy. Do you have like a history of an eating disorder, any kind of food trauma or food insecurity that if you haven't worked through it yet, that might get in the way of your ability to be present and calm and positive at the table? And it's not your fault, right? It's part of like what we all deal with things. So now would be a really great time to go address some of those issues with a therapist so that by the time your baby has started solids or before too long, afterwards, you've been able to process some of that. And now you're really ready to like be there, be present, and be calm and positive at the table with your baby. One of the worst things you can do is to be stressed at the table. And that's actually why I created this like figuring out your best method. I worked with so many parents who just felt stressed out because they were introducing solids in a way that didn't feel comfortable for them. And they thought they were supposed to do it, whether it was because the doctor told them or their friend told them or whoever. So do know that like your presence, your calm, your demeanor at the table is really important to your baby developing appropriately with food as well. Okay, so almost there. These are just like some things to think about, like what's next. Um, some of these I've mentioned already. This might seem like a lot, but when you look at it, these are kind of like what I did was I went through my starting solids course and just kind of listed out like the things that I talk about in there. We've already talked about the science of readiness and the different approaches, but here's like so many more things that would be important to know about when, by the time or when your baby is starting solids. Oftentimes small things are missed, and that's when I see patients in my office. Like, they're a little older and there's like something that like didn't get presented properly to them or whatever, and now they're having trouble eating. So, looking at this list, the ones we've talked about today, in detail, the top two, and the rest we've kind of like covered a little bit. Um, but if there's a lot on here that you're not sure about, that's the time to get help from a professional. It doesn't have to be me. There are plenty of people out there that do, starting solids or just like nutrition counseling. But I want you to work with somebody who is trained in pediatrics, who actually might even specialize in this stage of starting solids, because there's a lot of in-depth information that people don't know they don't know. Like some professionals think they know about like pediatric nutrition, but unless they've like studied starting solids, there's a lot that they might not realize that they don't know. So make sure that you're working with a professional, to learn some of this stuff, or take a course that was created by a professional. A lot of parents I work with feel overwhelmed by just like getting little bits and pieces off of TikTok and Instagram and stuff too. And of course, like I post some little bits and pieces as well, but because that's what the platform allows for. But might, if that's you, if you feel like I kind of know this, but I'm not sure about this, and too many little facts floating around, then taking some kind of course or working with somebody directly might be a better option for you. So you can just like go at it, you learn the stuff, you go at it with confidence, from there forward. Time is of the essence, though, of course. I mentioned like the allergen introduction, the nutrient introduction, the chewing. Like these are all things that you need to address like in the first couple of months of starting solids. So you don't want to like wait too long to learn about it, or wait until it has become a problem. Um, okay, so lastly, this is your homework, and then we'll get into some questions. So first, I want you to share what you learned today with your parenting partner and anyone else who you want to help you decide which approach you're going to use. Decide that approach, and then become prepared with like how you're going to do it. And then learn about all those things that were on that list that we just went through. Learn how to do this in a way that feels good for your family, that addresses all of those topics, and also prepare. So go through the checklist that I showed earlier that we'll be sending out. Make sure that you've kind of like gone through all of those things, so you're like ready before it's time to start. And that's it. So that's kind of like the four things that are going to get you set up. And all right, we've got like a little less than 10 minutes left, and I want to be able to answer whatever questions y'all have. I have not been paying attention to the chat, so I don't know if there's questions in there.
One question in the chat, Dana, it says, do you have any recommendations for a specific high chair that you like?
Good question. There are all different kinds of high chairs. So that's why I kind of leave it like pretty generic, because I don't know what people's price ranges are and like what stores you have available to you and all the kinds of things. There are really like expensive ones like the Kikaroo, and I think Stokey is the other one. Like those are great. They have the adjustable footrest, and they're wood and they're wonderful, but they're also the removable tray. They're also pretty expensive, and you don't have to go that route. There's also, I think it's IKEA that makes a very basic one that's like super easy to clean. And that is something you want to consider, is how easy it is to clean. So that one is great. And I cannot remember right now if the one that I'm thinking of has the adjustable footrest or not. So that would be something that you'll want to make sure to double check on there too. But I just like to give like what to look for in a high chair, and then you get to shop for it, because I right now don't have any particular brands, but I should. I'm gonna add that to my list to find one that I really love, and maybe I can become an affiliate of theirs and start recommending their chair, because there are some like really some things that you want to look for, like the removable tray, um, adjustable footrest, and easy to clean. Those are the three that I would pay attention to. Any other questions? And yeah, just like Ashley said, y'all can, if you want to unmute yourself and ask, if that's easier, you can do that. And I don't mind if you have like a crying baby in the background, all good. And then if you want to type it in the chat box, you're welcome to. While we're waiting for more questions to come in, I just want to point out, this is my direct contact information here. And you can definitely, like, easy to access. This phone number you can call, or you can text me at this number. And, it's directly like my email address, my website here. So Feel free to email me any questions that you have, and we'll send some follow-up information too.
We have a couple more questions. How to tell if baby is in distress while eating or just uncomfortable? To clarify, when should you stop trying to start solids and seek professional help?
So that's a great question. So if your baby has met all the signs of readiness, they're at least 6 months old, and you're feeding them and they like freak out every time you put them in the high chair, I wouldn't say you need to stop solids, but there are some things that you can do to like help make them more comfortable. So I'm not sure if that's like if you've had an experience already or if you're just like wondering what to look for. Um, if your baby is younger than 6 months old and it seems like they're uncomfortable or in distress, like at all, like there's no problem in stopping and waiting until they're 6 months because that's the time to try it anyway. So I wouldn't hesitate to say like starting solid, like stop solids if they're younger than 6 months. Like that's fine. You can just stop and then wait until they're 6 months old and there's no problem with that. That won't confuse them. It won't like cause any problems. And in fact, it might make the experience better for them once they turn 6 months old. So if you give them a break from it and then like once they're ready, you can put them back in the high chair. Um, so I hope that is answers your question, Mary. I don't know if you have like a more specific like situation.
He said, thank you, it does.
Okay, great.
And then we had, do you have any suggestions on scheduling, such as when starting one solid a day, multiple solids a day,
Got it.
meals a day,
Yep.
excuse me.
Yep. Cool. Thanks. And then and then I did see there was another follow-up to that too. I kind of like peeking at the chat box as well. So yes. So in the beginning, it's around once a day. It can be any time of day, but you want it to be when your baby is like in a good mood, happy, was well rested, and when they're well fed. So that's another thing that surprises people. You don't want to put them at the table hungry. The purpose is not to get as much food as possible in them from from the start. The purpose is to give them a positive experience. And this actually, Mary, might answer your question too. Like if your baby has met all the signs of readiness and they're really like not happy at the table, it could just be because they're hungry. And it sounds really counterintuitive, but if they're hungry and you're sitting them down to eat solids, and it's very early on, like within the first few weeks, they are going to get super frustrated. It's a totally new skill. So you want to make sure that they're nourished before you actually sit them down at the table. So those are, Jack, to answer your questions, those are the main things. Just once a day in the beginning. You want to build up to around twice a day by 7 months old. And then, so how much solids versus milk? Infant milk should remain unchanged. You want to continue offering the breast or bottle as much as you have. It's not going to change for a while, like closer to 10 to 11 months old, and your baby's going to take the lead on that. So you still keep offering infant milk the same exact way you were before. And now it's like you're introducing solids as an experience, not really as like nutrition provisions yet in the very beginning, like first month or so, right? So hopefully that clarifies that for you too. Great. All right. Like 1 minute left. I don't know if there's any last minute questions or anything. And one thing I forgot to put on here that I'll have you actually send out afterwards too is I have like an easy to access like web address for my online community. So in case you're curious about that, of course, no pressure. It's just one option for you. But if you want to learn like a lot deeper in all this and get like a supportive community and live help from me as well, that's nourishedfoundations.com. And I'll put that in the chat as well. nourishedfoundations.com, and that will get you to all the information about like the resources that I provide for my online program too.
Excellent. Thank you so much, Dana. Such valuable information. If you guys think of any other questions and you've lost Dana's information, please feel free reaching out to me and I can always get you linked up with her. I'm at ajohnson@yanamom.com.
Awesome. Thank y'all so much for being
Awesome.
here. I really appreciated having you. Thanks for all the thoughtful questions. And I hope I get to see you around or hear from you in the future.
Thank you, Dana. Thank